Welcome to the series Minerals for Whole Health, short lessons on the minerals that keep our bodies functioning optimally. I'm Thomas Lemke, registered dietitian and the clinical director of Whole Health. This installment is about calcium. What is calcium? It's a chemical element, which you can find on the periodic table under its chemical symbol Ca, which is conveniently the first two letters in calcium, as well as the Latin word calx, meaning lime, from which it is derived. Calcium is classified as an alkaline earth metal and is the fifth most abundant element in the Earth's crust. Conveniently, it is also the fifth most abundant element in the human body. Most calcium on Earth is in the form of calcium carbonate, which is found in limestone, as well as fossilized sea life. Calcium has numerous uses in the human body, but we will keep things simple and primarily discuss three. In the first place, calcium, along with the mineral phosphorus and the protein collagen, is the major constituent of your bones and teeth, where it provides the hardness and density that enables these tissues to function as designed. Calcium is also used for muscle contraction, where the flow of calcium ions facilitates the movement of the inner workings to increase tension and slide the muscle fibers along. Calcium also plays a role in circulation, where it factors into blood clotting, thanks to its role in stabilizing the needed proteins. It also plays a role in the regulation of blood pressure, along with vitamin D. But again, many more functions of calcium could be named, and we're still discovering more as well. Cases of calcium deficiency are progressive, meaning that in the very short term, they will manifest as things like muscle cramping and numbness or tingling in the fingers. With a continued calcium deficiency, this can then move to an abnormal heart rate or poor appetite. Finally, in cases of chronic calcium deficiency, even calcium deficiency that hasn't manifested any of those acute symptoms I just mentioned, you have the categories of osteomalacia, which is bone softening, or osteoporosis, which is brittle bones that are easily broken. Calcium deficiency in industrialized nations is historically rare. However, there are three groups that face challenges here. Postmenopausal women are at risk because the level of estrogen in their body, absent hormone replacement therapy, is lower. Estrogen helps increase calcium absorption and retain calcium within the bones, so a lack of it increases the risk of a calcium deficiency and its complications. Women with amenorrhea, a condition where menstruation has stopped for reasons other than menopause, are at risk for this same reason, lack of sufficient estrogen to assist with calcium transport. And of course, those who have dietary restrictions preventing them from consuming adequate calcium through dairy are also at risk, as dairy is the most abundant source of calcium in the human diet. It's worth noting at this juncture that certain medications can lower the absorption of calcium in your intestines or cause you to urinate more out. Chief offenders are corticosteroids like prednisone, excess sodium in the diet, and phosphoric acid in many dark sodas. Of course, excess alcohol can also do this. Now, for how much calcium an individual needs, for adults we have 1,000 milligrams or 1 gram per day between the ages of 19 and 70 years. After that, it increases to 1,200 micrograms per day for men. Women, the cutoff is different. It is at 50 years that the recommended dietary allowance moves to 1,200 milligrams per day. And that is, of course, because of that menopause. Good sources of calcium include dairy in the forms of milk, cheese, yogurt, kefir, and so forth. Calcium fortified orange juice is popular these days, especially with the dairy-free crowd. Leafy greens, almonds, canned sardines, and of course you've got the calcium fortified different milks on the market now as well. I mentioned the orange juice, but you've got things like almond milk and oat milk and coconut milk and so forth, soy milk, that also are fortified with calcium. Those can also be a good source. Now, some of these foods, like the almonds and most of the leafy greens listed, contain a high amount of a molecule called oxalate. High intake of oxalate and calcium together increases the risk of kidney stones. They tend to combine in the kidneys to form those stones. So take that into consideration when making your dietary choices. Furthermore, the rate at which calcium is absorbed from these various sources differs one from another. So be sure to include a variety in order to meet your calcium needs. When it comes to calcium toxicity, the symptoms to look out for are weakness and fatigue, nausea and vomiting, shortness of breath, chest pain, and heart palpitations. Chronic calcium toxicity can result in the mineral building up within the soft tissues, such as arteries and veins, resulting in high blood pressure and other cardiovascular complications. To address this, bear in mind the recommended upper intake level of 2,500 milligrams daily, which goes to 2,000 milligrams daily at age 50 and up, because the risk of kidney stones increases in that demographic. And of course, some of these symptoms are fairly general as well, so it is advisable that if you are concerned about a calcium toxicity, that you speak with your provider. Thank you for viewing the calcium installment of Minerals for Whole Health. We'll see you around.